Welcome back. This section we're going to talk about pediatric feeding disorders, and here to help me do that are Dr. Vesna Martis-Kriss, who's a pediatric radiologist. I get all that right?
Yes, you did.
And Miss Amber Valentine, who's a speech pathologist. And you're both at Brandon Crossings Baptist Health, correct? All right. Before we get into the pediatric feeding disorders, you are a pediatric radiologist, which is different than an adult radiologist. What makes pediatrics
It's
more
very
focused
different.
there?
I diagnose diseases in children only, and I use a variety of tests, meaning radiographs, x-rays, ultrasound, CT scans, to take pictures of the inside of children in order to make a diagnosis. Once I make the diagnosis, and I can send that information to the referring doctor, who can then start treatment.
Okay, well, let's talk about one of the things that you all are seeing and are actually focusing on now are pediatric feeding disorders. Dr. Kriss, give me an example of what's something you might see, some symptoms that a child might have, because we all have trouble with burping and spitting, and not all that's abnormal.
These are usually more consistent problems: spitting and gagging with meals, maybe refusing foods entirely. Some kids just won't touch solids at all. They may be developing pneumonias, food going down the wrong way. They may be spitting up, or more seriously, they may be actually losing weight or failure to thrive. All these are symptoms that we need to evaluate, which we'd like to do as soon as the children starts exhibiting these symptoms.
Okay, so you usually get referrals from the primary care physician's office. So when I get what's a red flag that I need to send them to you? Is it weight loss?
Those are the more severe ones that we deal with. It may be something as mild just as refusing certain foods, gagging and reflux symptoms as well. My job is to make sure that there's no medical problem that needs to be treated. Most of the time, these children do not have a serious medical problem. They can be dealt with Amber here, with speech pathologic techniques that they do. But my job is to make sure that child doesn't have some kind of a congenital defect, some abnormality that requires medicines or treatment prior to instituting therapy.
Okay, Amber, what do you see initially? How do you evaluate them, and what do you do for the feeders?
Typically what happens if they come to me first before they get to the radiographic imaging is we get a kid who's a picky eater, like she was mentioning, or a kid who isn't transitioning between foods. For example, they won't stop taking the bottle, they won't stop taking stage 2 or smooth baby foods or something like that, so parents are concerned that they're not eating. Or they could be failure to thrive. We get a lot of kids who are still on feeding tubes, kids who have had heart surgeries or other surgeries, kids who have been in the NICU. So we get a lot of those kids who just aren't transitioning well. So I will start evaluating them, and typically there's a few things that cause feeding difficulties in children. Oftentimes it's kids with sensory integration disorders, kids with a GI difficulty, which is where they end up between Dr. Kriss and I doing all this imaging, an upper GI, modified barium swallow, and so forth. Or it could be kids with food allergies or something like that. So we're evaluating in the beginning to see what the cause is of the feeding difficulty before we can even provide treatment, because we don't know what we're treating yet.
You mentioned some tests there that you do. Tell me about those tests.
The most basic one is called a modified barium swallow. We actually watch the child eat food. We have them drinking liquids, we have them taking pudding and paste, and we try solids, and we watch to make sure their oral motion is correct, to make sure their swallowing is correct, to make sure food's going down the right way where it needs to go. And we look for reflux, where the food comes back up. And those stomach acids can cause a lot of burning and irritation and make the children miserable, and they don't want to eat. So these are all anatomic defects that we're looking for that we can potentially treat prior to needing therapy for these kids.
You mentioned the term too, Amber, sensory integration disorder. I guess autism or that type of, would that fall in that category?
Absolutely. Any kid that might fall somewhere on the autism spectrum disorder, or even kids, for example, I said in the NICU, oftentimes kids who have been in the NICU have feeding difficulties. They've had just a rough start in the beginning with their feeding, so they develop aversions to feeding. Even kids with just other sensory issues, for example, maybe they don't like certain textures, or they don't like to take a bath, they don't like loud noises. So even kids maybe who don't necessarily fall on the spectrum but have other sensory issues, they will land in one of our labs because of feeding difficulties related to their sensory difficulties. So they have that oral aversion, they're spitting food out, they're not transitioning to solids, and so forth. I mean, we've had kids who are even 4, 5, and 6 years old who are still on bottles or still on smooth textures and haven't been eating solids.
That's one of the things, Dr. Kriss, that you mentioned earlier when we were talking, that it's important to catch this and treat it early.
Oh, it is. I mean, it is difficult and just to take care of these children when they're small infants, to try to get them into the right path. But when you've got a stubborn, headstrong toddler who refuses certain foods, or a 4- and 5-year-old, it just made it so much more difficult for all of us. especially for the poor PAM families who've been putting up with this for several years. So we really want to get these kids early. Treatment does better when we start early. We like to be preventative, to try and take care of problems before they take hold, rather than on the backside trying to break bad habits that have begun.
It's great information. Thanks for coming in and sharing with us. We'll be right back.